Hi, everyone, and welcome. My name is Rayanne Banaga, and I'm here on behalf of Race and Disability Canada. We are a community-led national organization dedicated to advancing disability justice through an intersectional lens. Thank you so much for joining me today. I'm really grateful to be here. I'm going to be talking with you today about the intersections of race, disability, and poverty in Canada. Before we begin, I'd like to acknowledge that we are gathered, even, even if virtually, on lands that have long been cared for by Indigenous peoples. At Race and Disability Canada, we recognize the enduring legacy of colonization and oppression experienced by Indigenous peoples of Turtle Island and Inuit Nunangat. Our team lives and works on many traditional territories. The land that I'm personally situated on is the traditional territory of the Haudenosaunee and the Anishinaabeg Nations, within the lands protected with the Dish with One Spoon Wampum Agreement. We believe that disability justice work is inseparable from decolonization, and so we start by grounding ourselves in that commitment. And this acknowledgement is a reminder that our work to address the intersections of race and disability is deeply connected with Indigenous solidarity. We recognize that Indigenous people with disabilities experience disproportionately high rates of discrimination and marginalization, and we are committed to working in unity for Indigenous rights. Our journey to uphold this commitment of solidarity is ongoing, and we strive to strengthen our efforts in doing. To start off, I would love to give you some information about who we are here at Race and Disability Canada. As I said, we're a community-led organization, national organization guided by the experiences and leadership of Indigenous, Black, and racialized people with disabilities. We conduct research and provide education and training to understand and amplify the lived realities of Indigenous, Black, and racialized people with disabilities across Canada. We do this through transformative research, dialogue, education, and advocacy, all grounded in an approach from decolonial and anti-oppressive framework. Our mission is to advance disability justice by challenging racist ableism in our institutions, systems, and everyday life. And we live by a principle that I'm sure many of you know very well, nothing about us without us. And so everything that we do, research, advocacy, training, all begins with those most impacted, leading the conversation and shaping our outcome. So today's session will explore how systemic racism, ableism, and economic exclusion intersect with deepen poverty for racialized people with disabilities in Canada. We will also engage in a conversation about what we can do together to shift these systems towards equity and inclusion, including what we do here at Race and Disability, and by exploring how communities with lived experience can and already are leading the way towards solutions. So as we move through this session today, I invite you to think together with us about what equity and justice can look like when led by lived experience and community-led research. So let's start with some context. According to Canadian government data, we know that working age persons with disabilities are significantly more likely to live in poverty than people without disabilities. What we found is often missing in this data is how race compounds with that reality. Through, through our research, our IDEA research initiative, we investigated the direct lived experiences of Indigenous, Black, and racialized people with disabilities in their own words, and found that race was a significant factor compounding disability-related challenges. Participants cited significant challenges and discrimination in employment, education, immigration, healthcare, and access to support services. And so at RDC, we use two terms that really help explain and understand these experiences. The first is racial ableism. We use the term racial ableism to describe the intersectional discrimination experienced by racialized people with disabilities. So where racism and ableism combine to create unique barriers and marginalization that racialized people with disabilities experience, often in an invisible way. One example of racial ableism is the experience of a Black person whose disability is dismissed as a behavioral issue and then is denied support services and meaningful care. The other term that we use at RDC is racialized disablement, And this speaks more specifically to the ways that racism and ableism work together to create or worsen disability for people who are racialized. This can be seen in low-income neighborhoods with high populations of racialized people that are more exposed to environmental hazards, lack green space and clean air. And then this negatively impacts the health of people in those communities, which then creates or worsens disability. Racial ableism and poverty are interconnected, where systemic discrimination results in creating higher poverty rates for Indigenous, Black, and racialized people with disabilities. So, for example, discrimination in employment. Um, for example, employment rates for racialized people with disabilities are lower, and therefore incomes are smaller. Um, or immigration and documentation challenges, where newcomer individuals with disabilities often fall outside of eligibility frameworks, which then results in less access to financial support. On the other hand, racialized disablement intersects with poverty somewhat inversely, where the discrimination and systemic racism that racialized communities face also causes and exacerbates negative health outcomes, which then leads to increased disability in racialized communities. So Black and Indigenous people, for example, are more likely to experience poverty due to systemic racism, which then leads to things like food insecurity, lack of access to healthy foods, um, which then negatively impacts the health of people in those communities. So with racial ableism and racialized disablement, um, this basically creates a mutually reinforcing system where racism and ableism creates and worsens poverty, and racism and poverty creates and worsens disability. So in Canada, both racial ableism and racialized disablement shape who becomes poor, who stays poor, and how people are experiencing poverty. As I mentioned, these systems overlap, and that creates these deeper barriers for racialized people with disabilities. Here's some examples of here are some more examples of how that happens. The first is, like I said, discrimination in work and education. So racialized people with disabilities in Canada often face both racism and ableism when trying to get an education or find work. For example, employers may assume that racialized workers with disabilities are less capable, or schools might not provide accessible learning supports to Black, Indigenous, and racialized students with disabilities. And then these patterns make it harder to find good paying, stable jobs, and therefore keeping people in lower income positions. The second is an unequal access to healthcare and social supports. Racism and ableism in Canada's healthcare and social system means that racialized people with disabilities often don't get the care or assistance that they need. Many encounter language barriers, lack of cultural safety, or disbelief from service providers. And because of this, they may not qualify for or trust disability benefits. As such, leaving them without the financial supports that they rely on, sorry, that others rely on. And of course, we have the structural causes of disability and poverty, where poverty itself, like I said, can lead to disability through unsafe housing, poor nutrition, environmental hazards, chronic stress. All of these conditions are more common in communities affected by racism, especially in Indigenous and Black communities. When people in these communities become disabled, ableism compounds those barriers that they're already facing. And like I said, again, it reinforces the poverty cycle. So what we've learned at Race and Disability Canada is that a huge part of understanding the structural and systemic nature of these problems and how they're showing up today requires acknowledging where they came from so that we can make changes that help build a better future. So historically, colonial and eugenic policies determined who was considered fit, productive, and deserving of care. And the purpose of that was to exploit Indigenous, Black, and racialized people for their land, for their labor, and for their bodies. But notions of who is deserving of care, support, or resources are all rooted in these colonial settler eugenic frameworks that continue to shape policy and practices that marginalize people with disabilities into poverty today. Um, This is still present in the existing support systems that we have today, um, most notably in federal and provincial disability benefit programs. So things like the Disability Tax Credit, the new Canada Disability Benefits Act, which are all structured with eligibility criteria that exclude the lived reality of racialized people with disabilities. So while these programs are meant to reduce poverty and support financial security, it's really obvious that Indigenous, Black, and racialized people with disabilities were not sufficiently consulted and included in their design. Accessing these benefits requires navigating complex bureaucratic systems, which is not very accessible for people with disabilities as well as people with language barriers, often without culturally responsive support or community-centered outreach. The amount of financial support offered is completely disconnected with the cost of living, and especially with the cost of living with a disability. And finally, like we said, eligibility criteria excludes a lot of people who need it most, including newcomers with disabilities, people with not apparent and episodic disabilities, people in precarious employment situations, and people with diverse family structures. This is all very consistent with what participants emphasized in our IDEA initiative. They emphasize that program design often does not reflect their realities, and those realities include unpaid precarious labor, cultural and language barriers, lack of trust in institutions, and that very real extra cost of disability. So, what needs to change if we want to build systems and programs that are truly equitable and inclusive? At RDC, through our Cultural Diversity and Inclusion Research Initiative, what we're learning is how important it is to also approach our work with cultural humility. We're recognizing that disabilities understood and experienced vastly different, very differently across cultures, and that some of our own assumptions might be shaped by colonial or ableist frameworks that aren't universal. Many cultures actually resist deficit models of disability and instead build on community strengths where care, interdependence, family networks, and community support are central ways of being. And these have the potential to produce much more empowering and equitable outcomes for people with disabilities. And so I believe it's really important to invest in community-led initiatives that build on these approaches. Organizations led by Indigenous, Black, and racialized people with disabilities are already doing the work. And are already providing accessible information and services. They provide peer support, advocacy, and culturally grounded resources. These organizations and these services often just need sustainable funding and decision-making power. While benefit programs like the Disability Tax Credit and the Canada Disability Benefit were meant to support financial security, the design processes didn't meaningfully include racialized people with disabilities. And so they continue to fall short in making a real impact and will continue to fall short unless people with disability, like racialized people with disabilities are involved in redesigning them. So disability benefit systems should be redesigned with communities, not for them. And that means working alongside people with lived experience at every stage from design to implementation and to evaluation to ensure that eligibility and support reflects our diverse realities. We also need to make access much more equitable and much simpler. So that includes indexing benefits to the cost of disability, um, streamlining applications, offering culturally grounded navigation support, and ensuring that people aren't penalized because of their experiences of disability don't fit a medical or bureaucratic mold. At the broader policy level, we believe that intersectionality has to be embedded, meaning every disability policy or program must consider how race, indigeneity, gender, and class all intersect to shape access and outcomes. And that's how we believe that we move from a one-size-fits-all model to one that's justice oriented and community specific. As a research and education-oriented organization ourselves, we believe that this is in large part shaped by how we produce knowledge and who gets to shape that knowledge. So that's where we're trying to start with ourselves, and we're trying to change. And that's exactly why we're trying to change in our research, because we know that traditional research approaches, especially in racialized communities and disabled communities, often reproduce the same power imbalances that we're trying to dismantle. Research has really often been something that's done on our communities and not with us, with people being treated more like data sources rather than as partners and knowledge holders. So, in addition to advocating for more research that is led by Indigenous, Black, and racialized people with disabilities, and based on the research prior the research priorities of our own community, some of the ethical considerations that we've adopted to put this into practice include fair and accessible compensation and honoraria for lived experience participants, budgeting for accessibility support so participation isn't burdensome, involving communities in shaping the questions, methods, and analysis. And I want to say not just involving, but being led by communities. Um, collecting data in ways that protect their dignity rather than increase surveillance. So things like storytelling narratives, intra-community interviewing amongst each other, and of course, sharing the research with the communities that are involved in that research, and making sure that they're not only part of the data collection, but also a part of the outcomes and what's done with the research. We embrace the idea at Race and Disability Canada that research is never neutral, but rather that it's a relationship that has to be ethical, reciprocal, and it has to be materially just. So our goal is to produce research that helps to reduce poverty, not reproduce it. And we believe that research itself can um, can be a mode of redistribution in our community. So as we end off today, we at Race and Disability Canada would like to invite you to join us in reflecting on how our own practices can move us towards larger system change. And so I'd like to leave you with these three questions to reflect on and think through what kind of changes can be made from exactly where you are. The first is whose expertise shapes the programs that you work with? What invisible assumptions might still be baked into eligibility, outreach, or design processes? And what's one change you can commit to in your own role and organization to redistribute power, resources, and access? And with that said, thank you so much for sharing your time with me today. I really hope you join us at Race and Disability Canada in continuing this work and in helping us move from awareness to action. If you'd like to stay connected with us, you can find our contact information here on screen. And thank you so much also to the wonderful folks at Disability Without Poverty for the incredible work that you do and for the time and space that you've given us to share with you today. Thank you and take care.